perpetual permission of harm reduction only policies, not prohibition, is putting lives at risk. I want to just spend some time in this particular section looking at some of the big costs. As we just heard before from Tracy about some of the harms and some of the grief that they experienced, drug use is not a victimless crime, as so many hapless drug users would tell you. There are big costs involved, and three of those ones which we're going to just focus a little on here are sex slavery, environment, and human trafficking. Just looking at some of the data coming out of the EU Drugs Market Report in 2016. Illicit drug use, wider criminal activity and terrorism, impact on society more generally, impact on the legal economy, strain on government institutions, and of course, you break that down, it goes even further, as you can see up there on the screen. Snorting away our planet's lungs. Drug money destroying swathes of forest in Central America. A study from 2017 reveals cocaine traffickers attempting to launder their profits are responsible for the disappearance of millions of acres of tropical forest across large swathes of Nicaragua, Honduras and Guatemala, turning biodiverse forests into agricultural land. The study lead author, Dr. Stephen Cesny from the US Fish and Wildlife Service, said most of the narco-driven deforestation we believe identified happened in biodiverse moist rainforests. Demand also empowers sadistic cartels. If you think one person's consumption, this is the New York Times, by the way, not one of the great anti-drug voices in the marketplace right at the moment. If you think one person's consumption is too small to make a difference, consider that $100, what a recreational cocaine user might spend on a single weekend, that's in America, in Australia it's about $400, buys a cartel 500 rounds of ammunition, $500 buys a new AR-15 rifle, and $700 covers the monthly salary of one of their gunmen. Again, the recreational use of the cashed up, entitled, middle-class American hedonist. What about Sustainable Development Goals? Really interesting here. So there are 17 Sustainable Development Goals. Of those 17 Sustainable Development Goals, the majority of them are impacted by alcohol or other drug use. So the Sustainable Development Goals are as follows. To end poverty in all its forms everywhere. Alcohol and other drug use impacts that. Number 2, end hunger, achieve food security and improve nutrition and promote sustainable agriculture. Alcohol and other drug use influences that. Ensure healthy lives and promote well-being for all ages. Alcohol and other drugs undermines that goal. Ensure inclusive and equitable quality education and promote lifelong learning opportunities for all. Arguably that is, but we'll give that a pass. Achieve gender equality and empower all women and girls. That is undermined by alcohol and other drugs, as you'll see later on. Ensure availability and sustainable management of water and sanitation for all. That is definitely undermined by alcohol and other drugs. So as you can see of the 17 Sustainable Development Goals, the vast majority are impacted by alcohol and other illegal drug use. That should be enough to change our behaviour. That should be enough to change our cause-focused mentalities, but it appears not. What comes before addiction? For starters, when substances, both legal and illegal, are promoted, they're bombarded. You're told that pain is bad, and the messaging is consistent that you've got to get rid of pain at all costs. And pain is a bad thing, and if pain's in your life, you can't enjoy life.
Biggest chance I go into coaching.
Panadol Rapid. When pain is gone, life takes its place.
Of course, experimentation we talked about before. Young people always experiment. Yeah, it will come into play, sure, and depending on the messaging and the permission models that are in play, depends on what young people will experiment with. They could explore great causes that are going to make the world a better place, or they can experiment with psychotropic toxins just to get a shortcut to a high and step into a place of dysfunction. But again, who's selling the messages? What's normal? What's right? Is rebellion normal? Not every teenager rebels. What does rebellion look like? In this day and age, it would appear rebellion would be the person that doesn't use drugs. But we'll keep moving on. So what else comes before addiction? Okay, mental health issues, they can play a part. Now we know from a lot of the science from cannabis users, in fact the data come out very recently from a major cohort study, is that all cannabis users, not just those with predisposition to schizophrenia, but all cannabis users are at risk of psychosis. That's a very new study came out in June 2018. But mental health issues can actually facilitate drug use. We understand that. But the mental health issues can also come after drug use. Of course, abuse in the family or at school, in the system, they can all facilitate drug use. So I get that. Trauma, normal life out, and self-harm in. These are things that can all influence the uptake of drug use. We totally understand that. So what is wrong? Addiction is a crisis in our society, not just with substances, but with other elements as well. So this crisis needs to be looked at, not just from a remediation and a damage management model, but more importantly from a prevention and demand reduction model, first and foremost. We also need CAT teams, critical incident intervention teams, that help with obviously mental health episodes, but we advocate for the need for street workers that actually do the same with drug use. And it's not about giving them syringes and helping them take their drugs safely, but actually facilitating them getting into safe places for therapeutic assistance and help and recovery. Public health carries long waiting periods, so we need to work on that. We need to see those changes. We need to facilitate more in the recovery end. So we're actually promoting the exit from drug use, not just the ongoing of drug use, more importantly. Private healthcare carries high fees and regulations. That needs to be changed and monitored. These are things that we're advocating for as well. I think a caring society that wants to reduce, remediate and facilitate recovery from drug use must focus on. Short-term solutions, a response team, as I said before, equipped outreach workers working in the streets with people, helping them get into a recovery mechanism. A plan that works for both public and private patients. It's very important, so we're not having long waiting lists and exclusive places only. Government that supports and creates policy for both the private and public sector. Very, very important. We advocate for the expansion of drug courts. Again, this is why it's important to keep drug use in the illegal sector, because drug courts can be an incredible diversion tool. Criminalising drug use isn't about a punitive response. It's not about punishing the drug user, but it is a vehicle that can facilitate a movement into recovery. And without that vehicle, it's very difficult to facilitate that mechanism of change. So, problem-solving courts. So there's a better name than drug courts. They're non-adversarial models that's about rehabilitation and not punishment. I love this quote from one of the drug court architects coming out of America. We should incarcerate people we are afraid of, not people that we are mad at. And I think that's a really good little caveat to have in play. For justice to work, though, it says in the drug court, it must be swift, sure, consistent, and proportionate, not necessarily severe, as the following happens. We call that the judicial educator. The judicial educator is incredibly important in this place. And they say in the judicial education space, leniency is not kindness. And that's what we're seeing. This permission model is creating not exit from drug use and better outcomes, it's creating ongoing drug use. That was from Steve Holm, Project Hope. I love this quote from criminologist James Q. Wilson, who used the analogy of how we respond to criminal offenders, particularly drug users, and their ongoing behaviour. Johnny, if you don't clean up your room right now, there is a 40% chance that in a month from now, I will ground you for 2 years. That's why the drug courts and the problem-solving courts have a swift and consistent and immediate response. They want to help the drug user and others involved in this system to exit the behaviour to move into a more productive space, not punish them, not cause them grief, but to help them become the better human beings that they know they want to be, and we can help them do that. Again, the judicial educator in work. These judicial educators, including drug courts and Hawaii's, for example, Opportunity Probation with Enforcement program, HOPE, are vehicles that are not only reducing probation breaches and recidivism, but significantly reduce drug use and increased sustained abstinence. That's a key. They increased sustained abstinence, which in turn aids and abets integration into society and productivity. Long-term solutions, holistic approach, of course, family supports and empowerment for individuals in schools and workplaces. Therapeutic communities are incredibly important in this space. Building resiliency back into communities, building resiliency into families, and again, exiting drug users when they're employed, when engaged in family and community, do much better in their recovery and sustain it for a lot longer, if not permanently. National Institute on Drug Abuse in America made this statement: addiction treatment must help the person do the following. Stop using drugs, very important, not ongoing drug use. Stay drug-free, be productive in family, at work, and in society. Just echoing the things we've just looked at. There was a survey done recently, and it costs more to keep users using than to put them into a not-for-profit therapeutic community, which costs about $65,000 a year to run. But according to this survey, the cost of continuing drug use, when health, welfare, legal and law enforcement costs were considered, it is estimated that each person in this survey would cost the government taxpayer approximately $181,000 a year to keep them using drugs. So the question we've got to ask is, who's interpreting this drug policy, and why is this interpretation continuing to undermine best practice?